Thank you for joining us for Memorial Healthcare's Community Conversations. In this weekly video, experts from Memorial Healthcare will answer your questions about how we're caring for our communities during the COVID-19 pandemic, and also update you on new services and offerings at Memorial Healthcare. Today we're hearing from Cassie Kolarchek, Director of Memorial Healthcare Emergency Services, and Dan Mills, Associate Vice President of Patient Care Services and Chief Nursing Officer.
In the emergency department, we have separate individual rooms. We have designated rooms for potentially COVID patients. We have partitions up around the nurses station. All of our nurses and providers have the equipment to wear. They wear face masks the entire time, face shields. If there's a potential COVID patient, we go into what's called full PPE. So we do gown, gloves, goggles, the N95 masks, and a cover over the hair. In and out in every patient room, we change all of that, so that way we're not having any type of cross-contamination. Our staff wears masks the entire time that they care for patients. We follow all proper hand hygiene as well. We try to limit the amount of people in and out of a room for a potential COVID patient. If we have a known COVID positive patient, we designate staff to be in that room, so that way we're minimizing the amount of interactions with outside staff. And we limit our visitors that are coming into the emergency department right now.
In addition to that, you also see us frequently disinfecting common areas like the waiting room and the bathroom. We understand that those are important things for us to do to ensure that we are keeping our environment as safe and as clean as possible for patients and visitors.
Absolutely. The other thing that we do is any patient that comes in presenting with COVID-like symptoms, we try to get them immediately back to a room right away, so that way there's no time in the waiting room for them. And we have signage on the doors, so that way everyone's informed, so we can make sure that we're staying safe with our staff.
We understand that coming to the hospital anytime is scary, and we understand that COVID-19 has made that even more scary for our patients and our visitors. And we want you to know that it's safe for you to seek care at Memorial. We do everything we can to keep the environment safe and keep our patients and visitors safe.
We also understand that these last few months have been very challenging for everyone, especially people that have chronic diseases. So we want you to know that if you are having any complications, please do not hesitate to come to the emergency department. We will be able to care for you. We will be able to keep you safe. When you first arrive, whether it's you as a patient or you as a visitor, we are going to screen you and we are going to give you a mask. You will have to wear for the duration. That's not only to protect you, but to protect other people that you're going to come in contact with. Our waiting room has partitions built into it to help separate everyone. Our intention is to always bring every patient directly back. If you are presenting with COVID-19 symptoms, we will be taking you straight back to a room. All of the rooms in our emergency department are cleaned from top to bottom between every single visit. Once you're in a room, all of our rooms are private, which means that there's no interaction between you and another patient. All of our nursing staff and all of our providers and everyone that you're going to come in contact with in the emergency department will be wearing appropriate personal protective equipment. So that will be at a minimum of a mask. If you are presenting with COVID-19 symptoms, we will take extra precautions where they will be wearing a face mask, goggles, possibly a second mask, a full gown, gloves, and some type of hair covering. That will be changed every time the provider or nurse comes in and out of the room and between patients. So there will be no cross-contamination or exposure to anyone else. We ask that you be understanding because we want to ensure that the safety of you, your loved one, and our staff is at the forefront of what we do every day. Previously, when everything was unraveling with COVID-19, there was a lot of unknowns. At that time, we went on complete visitor restrictions to protect the safety of both the patients and the staff that were working. Now that we have better precautions in place, we feel comfortable allowing one visitor with every patient that arrives. This will not only help with the care, that invaluable information that we need from that loved one, it will also help ease any concerns and worries that the patient may have. When that visitor comes in, the same precautions will need to be met. The visitor will have a mask on the entire time, and we will ask them to stay in the room as opposed to coming in and out. And that's to limit the visitor's exposure to any other patients that we're caring for in that area.
We understand the important role loved ones play in the care of our patients. So we want to make sure that we are doing everything we can to allow patients to have a visitor who can help with their care while simultaneously keeping everyone as safe and healthy as possible.
So what if my loved one wants more than one visitor, or we need to have more people involved? We have innovative and creative ways that we can help facilitate that. We understand that anytime someone's in the emergency department, especially if it's a critical situation, is very stressful and terrifying. We want to assure you that we are going to do everything in our power to connect loved ones to patients that we're caring for.
We encourage anyone who is having symptoms of COVID-19, such as shortness of breath, difficulty breathing, or chest pain, to visit us in the emergency department. In 2016, we did a renovation of our emergency department that provided for all private rooms for our patients and visitors. Luckily, this has played very well in our ability to care for you during the COVID-19 pandemic. These rooms allow separation of patients and visitors, which ensures that we are able to keep you safe and keep your exposure to a minimum.
Thank you for joining us today. If you have a question for Memorial Healthcare's team of experts, please visit our website at www.memorialhealthcare.org to submit a question. We will do our best to answer these questions on our weekly video or in one of our frequently asked questions updates. We ask that you follow our website and social media platforms to get the most up-to-date information. Memorial Healthcare. We're here, we're ready, we're keeping you safe.